Good morning, everyone. You'll hear from myself and Commissioner Gandhi. We have the IG, the Medicaid experts, Budget Director Mingy with us today. And you've received the packet as we continue on, and I think we've got again, building on a comprehensive package to address not just the fraud that has been pointed out, and again, a thank you to Tim O'Malley and the work that he did, our folks at Optum and the internal work that's being done, trying to get a baseline. I think many folks, myself included, when I came here, the discussion was, if you recall, clear back in 2019, that reforms around DHS as a large organization that does multiple things that we needed to think about modernizing. And as you get a chance, and I talk to my fellow governors and we talk to commissioners in other states, Minnesota's system of delivery around social services is a bit of an outlier in how it's done. And over time, many of them have evolved to a little different delivery model that gives more insight into and more control over where the money and the programs are going, Connecticut being a great example of that. So we consistently, though, and I will continue to say it, the very programs we're talking about makes Minnesota one of the best places to live, one of the best places to raise a family, one of the best places to start a business. On all the indicators of quality of life, Minnesota ranks very near the top because, in no small part, the services that come from the Department of Human Services. But we, as we've said, have a responsibility that these programs remain strong, accountable, and sustainable. Over the past several years, we have taken major moves to combat the fraud, to strengthen oversight, expand investigations, improve audits, upgrade technology, and increase enforcements. But protecting those programs requires more than just the enforcement. It's moving back upstream in the prevention model and examining those systems. Today, we're announcing a bold effort to transform how Minnesota delivers human services. Commissioner Gandhi will get into a little bit of the details, but here's kind of the top line. Modernizing a proposal on how Medicaid is administered. I think we've gotten it recently, and there's been some good stories written by all of you that the managed care organizations manage a whole lot of that information. Strengthening oversight of enrollment in these programs by centralizing eligibility decisions and funding a comprehensive study to examine the role of state, counties, and tribal nations in the delivery of these to provide more transparency and effectiveness. Again, Minnesota is one of only a handful of states that still operates a county-administered human service model. Counties and tribal nations are essential partners doing the work, but the system is growing too complex for necessary oversight. Now, I want to be clear. This is not putting blame on counties or managed care organizations. It's just stating a reality. As the system over the decades has become more complex and the systems have grown out, it has been difficult, and especially for the counties, to be able to administer those correctly. And so it comes down to it. I would tell you it is both the complexity of it, and you've seen the other pieces of this, outdated technology. The Maxis system is grossly outdated. It provides immense hours of frustration for really talented people trying to do the work, and there's ample opportunities in just an antiquated system that errors can be produced in that work. So proposal's bold. It's a starting point for reimagining how we deliver human services. We look forward to partnering with the experts, both inside the agencies and the legislative leaders. I have spent a lot of time with other states looking at what they did. I come back again to Connecticut as one that has fully gone to that centralized model more than any other, and they get rave reviews for the work they did. So I think in combination of addressing where people will continue to try and commit crimes, which they've done here, the ability to not just close the doors, or as some people want to get rid of programs, but to remodernize the delivery system, because the ultimate goal here is to get the resources to the people who need it to improve the quality of life, improve Minnesota. We're making great progress in that, but I think without the major structural changes, you're going to find yourself chasing your tail on some of these things continuing forward. And I think, as Tim O'Malley said, you can trace these back 40 years where a lot of these problems started to grow, and what you end up with in the systems, and as the rules were rewritten by the federal government, by the state legislature, and then how they were implemented, you end up with a bit of a Frankenstein monster that you keep putting bolts onto the side of it, and it becomes very, very difficult to administer. We think this is a way of simplification. It's a way to use best practices. It's ways to use modern technology. It's ways to use AI. And what that does is takes the burden off the counties, the managed care organizations, and gives the state and the taxpayers a much more transparent view in how the system works. So looking forward to working with the legislators. I think we have quite a good background of information. I think the scope of the programs that we've had a chance to pause, look at, that were in Tim O'Malley's work, we've got a pretty good idea where those things are at. We'll triage it in the short run, which we continue to do, but this is more of the long-range work that will have to happen, or this will continue. And I think, if I'm not mistaken, Tim was pretty clear about that as it passes from administration to administration, if you don't fix some of these systemic issues, whether that's having an IG at the Minnesota Department of Education or the ability to audit in a single audit, it's just going to continue to be more difficult. So I'm going to turn it over to Commissioner Gandhi, and then the five of us will answer some of your questions. I think you got the initial packet on this. Commissioner?
Thank you, Governor Walz. My name is Shireen Gandhi, and I have the honor of serving as the Commissioner of the Minnesota Department of Human Services. The proposals we're talking about today are not business as usual. These are bold ideas to address major challenges head-on to dramatically improve the delivery of Medicaid services for Minnesotans across the state. It's part of a continuum of reform that began in 2023 when the legislature and the governor decided to separate DHS, which had a broad scope of services that were very complicated to deliver, into three separate agencies. The Department of Children, Youth, and Families, serving the social welfare of children, the Department of Direct Care and Treatment, which is a behavioral health system for people with complex needs, and DHS, which is now a more focused Medicaid agency, as well as administering some federal funds for substance use disorder and behavioral health. The governor today is starting an important conversation about how we deliver and oversee the social services at the Department of Human Services. It's really about achieving better outcomes for people. We are proposing to centralize the administration of Medicaid by phasing out managed care contracts for Medicaid, changing how we serve about 80% of the Minnesotans who are on the Medicaid program, moving some of the work of Medicaid eligibility from the counties to DHS, easing workforce pressures that we are hearing about from our county partners at the local level, and streamlining how a person is eligible for Medicaid. Replacing contracted waiver case management with county employees who will ensure people with disabilities receive the needed services. The 11 tribal nations and 87 counties in Minnesota are valued partners in delivering human services. They are on the front line, working directly with the people we are serving. So we're funding studies to look at how we work together to improve partnerships in administering the programs, determining eligibility, and clarifying roles. We will work together to develop a long-term roadmap for how human services should be structured to best meet the needs of Minnesotans. Today, DHS is also announcing the release of a request for proposal on agency transformation. As we continue to implement the Governor's Executive Order 2510, DHS is moving ahead with plans to reevaluate and restructure the organization, operations, and the work culture. The state is seeking proposals from independent consulting firms to provide recommendations on improving effectiveness of the department. We're looking for the best ideas and the most skilled people we can find to bring transformational change to DHS. We are also, as an organization, looking at our culture, where 2,300 workers and managers support each other to catch and address problems early. It is essential that we continue to enhance and foster this approach for our long-term success. Now is the time to reform and refine the way Minnesota provides human services. Minnesota is striving to be a national leader in program integrity and eliminating fraud, waste, and abuse, while also having among the best outcomes in the country for Minnesota's 1.2 million people who rely on the services, including people with disabilities, children and families, and older adults. Thank you.
We know this is a big undertaking. It needs to happen. These are the structural changes that happen. This is not as simple as, well, people didn't care and they weren't watching, whatever. A lot of these are structural barriers or the divisions of how they go once they go to the counties, once they go to the managed care organizations, that we believe that there are better models, there's better technology. It's not going to be without its challenges. Just upgrading those legacy computer systems is a huge undertaking, but they needed to be done. They needed to be done a long time ago, but I think this is the opportunity now, all in one, to take care of it. So I look forward to working with there. Some really talented folks in the legislature that understand this issue pretty well. It's no secret to anybody in bipartisanly that I think folks knew that our system was antiquated. We knew that it had become cumbersome, and now we have to figure out the best way to streamline it. And so there's models out there. As we said, we're just one of a handful of states that still does it this way. Almost everybody else has kind of migrated away from that, and this will give us an opportunity to do that. And as I think the commissioner said, at this point in time, we're getting it to the point where I think our program integrity will be as strong as any state in the country, than most. So yeah.
Governor,
Yeah.
our reporting found that the managed care organizations were often the ones spotting and flagging the fraud that, to be blunt, the agency ignored or slowed. Is there support that doing away with the managed care organizations will reduce fraud and improve?
I can't speak to that. I don't know if anyone who's been there, let the IG.
James Clark, Inspector General at the Department of Human Services. To answer the question, I mean, I haven't seen any evidence that managed care organizations are better at spotting or detecting fraud than the Department of Human Services. I think right now the issue I'm seeing is we have a patchwork of Medicaid oversight in Minnesota, right? It's decentralized and complicated. We have 8 different managed care organizations with 8 different approaches to detecting and preventing fraud, and they're not necessarily sharing information with each other, right? So Medica doesn't know what Blue Cross is looking at. Blue Cross doesn't know what United Health is looking at. United Health doesn't necessarily know what other managed care organizations are looking at. So I think this proposal streamlines and unifies Medicaid oversight, and I think that's the direction we need to go as a state.
Governor, is the overall goal here to simplify and centralize so it's easier to spot fraud?
Well, I'll let maybe the commissioner talk about this too. And I said, I think, Tom, it's always multiple focuses of ours. And I think what gets lost in this is getting the services to improving the quality of life for Minnesotans first and foremost is a priority. But I think the conversation we've had in here is that it's not an either or, meaning we're focusing on getting the money out so we don't have time to focus on the fraud. It has to be 100% of both. So, Commissioner, I don't know if you want to talk what we get out of modernization.
Yeah, I think the decentralization and the fragmentation of oversight creates transparency challenges for the department. So if we have a single administrative service organization and we are uniformly applying enhanced prepayment review and post-payment review, then DHS has sight lines into that and is able to provide clear direction on how to manage and address those. I think also that also helps us with clear upstream policies and procedures, because we can't just be catching this on the back end.
Governor, do you need legislative buy-in on this already? DFL Chair John Hoffman said he's incredibly disappointed. He has committee jurisdiction. He just found out about it this last night.
Well, with all due respect, he didn't just find out about it. They do have jurisdiction. They need to work on it. The executive branch is responsible for carrying these out, and to be very candid, we're telling you that the way some of these things are structured are antiquated and we need to work together. So look, Senator Hoffman is an expert in this. I look forward to meeting and working with them, but we've got a responsibility to put our proposals out. So just candidly, I'm a little disappointed that we would start with that, because these are conversations that were brought to me before I was even elected governor and said, you're gonna have to do something with DHS. You don't have to tackle DHS. It's antiquated computer systems. It's decentralized control. So, yeah, we're going to need legislative buy-in. And I know there's people over there that are serious about it. Senator Hoffman is one of them. Not just talking about and admiring the problem and continuing to have hearings that should have happened 5 years ago. That's not getting us any closer. We're getting the data that we need. I think the window and the insight into where things are at, and now we're proposing fixes to this. So we'll need their buy-in, we'll need their help, and we'll take their ideas. So again,
Total numbers questions for you. How many additional staff would we have to add at DHS to do this? And what's the price tag here? If we're talking about updating those antiquated technology systems, I know those are big dollars. What's the cost? What's the staff?
yeah, and well, Anna. Then I'll let the IG talk about if you do this right, it's about the savings. So they pay for themselves.
So the most of the details I'm Anna Mingy, State Budget Director, MMB. Most of the costs associated with the transition of financial eligibility, some of the expansion of the state role in functional assessments and the studies that the governor discussed. It costs about $17 million in the first biennium and about $55 million in the 2028 and 29 biennium. The proposals associated with the details of the systems modernization proposals will be released later this month when the governor's budget is released.
And how many jobs would this grow state government by?
I think it's a couple hundred jobs sort of when fully phased up. You know, that's recognizing this is not, that's like the details of the proposal that you see before you. So it's not the full, if the state were to take on full administration of county human services work, it's a different scale, but that's not what the proposal is sort of in front of you.
Can you explain that? 70 plus 55 is before the computer system, just to clarify.
That's right.
And can you explain that you're talking about to get to full force of staffing that would be reflected in this? Is that because that wouldn't be effective until 2028? Like how, I guess.
Just clarifying that the proposal is taking on some financial eligibility work, a sort of some functional assessments support for counties, and then like not a pilot project, but several studies associated with full implementation. So the proposal is not for full implementation of total state administration of human services work. So there's more details on the paper, but just wanted to make sure you're
Maybe, can I
yeah, what-
just, I'd like to finish answering that question a little bit and then go to the next. So just to be clear, like before we do wholesale transformation, we want to study it. So important to study it, but we're taking some initial steps by taking away some of the very administratively burdensome, complex eligibility determinations that the counties currently have to do. So this is, we have been consulting with the counties. Julie Ring a while ago, the director of the Association of Minnesota Counties, had a very thoughtful editorial on redesigning human services. So we've been in conversation with them. That's an area where we would start taking those complex eligibility determinations for Medicaid. And then also creating a team at DHS that would help to monitor the Min Choices assessments, so for long-term services and social supports, and addressing any backlogs. So it's things like that that are funded in the front end, and then we'll have to see what the study shows in terms of where we go from there.
But to be clear, isn't it the thinking that start with the studies, but it says by 2028 you would absorb isn't that the vision that DHS would absorb
For the,
all of what the counties do?
not by not all of what the counties do by 2028.
So how many job losses could there be in the counties and in the 8 HMOs that are currently doing this? Could this be widespread job losses in Minnesota that the state then grows by?
No,
I don't
think
so.
that's a fair assessment. This is a remodernization. There may be some shifting, but the issues now is, and if I got the opportunity to go down and to work on these programs, it's incredibly frustrating. It is the most outdated system you can ever imagine, and there's better things the counties can do, and what we want to do is this will save counties money in the long run. How those jobs shake out and where it looks, I think that's still be determined. We'll be studying a lot of,
HMOs, they're doing this work. Wouldn't those potentially be job losses?
Well, somebody want to speak to the HMOs?
So I think that question is better left to them if their Medicaid lines of business were to phase down. So I think that's a question for the plans themselves. With respect to the counties, this is really seeking to address some of the workforce issues and the systems issues that they've cited. So we want to work with them on how to alleviate those pressures, see what the state can do in a more streamlined, efficient way. But we're not hearing from the counties that this would result in job loss because at this point they're overextended, many of them, in terms of the workload they presently have.
They're bringing a lot of this forward.
Medicaid with the new Medicaid work requirements coming in from the federal level?
I'm sorry, could you repeat that?
Yeah, how will this interact with new federal Medicaid work requirements?
Yeah, so the governor will have a proposal with respect to the work reporting requirements and how we implement them here in Minnesota. And the way that we're proposing to go forth with that is to have the state, of course, handle that workload within DHS. So that's going to be the proposal for how we handle that particular piece of HR 1 here in Minnesota.
And that's regardless of whether MCOs are.
Right, so that's a new above and beyond kind of current processes and policies requirement with HR 1 that we have to implement. And the way that the governor will propose that is that the state will take that on from implementation forward.
That'll mostly be paperwork requirement rather than work requirements, and I think both red and blue state governors are noting that with HR 1. So, yeah.
John might actually
Sure.
be the person, and you can do whatever you want. But how does this interact with the conversations you're having with CMS about the corrective action plan? Are some of these changes things that CMS has asked for as you navigate this broader funding fight with the federal government?
So those are really separate proposals that we have made in response to CMS's demand really for a corrective action plan. So we have proposed a number of actions that align with these proposals, but they're different. So taking on certain eligibility functions, administering the program through an administrative service organization centrally within DHS, those are things that I think will help us achieve some of the objectives in the corrective action plan that we've given to CMS. But I'd say they're aligned, but not directly, the same proposals that we've submitted to CMS.
The type of thing that the Trump administration, the federal government wants to see changes for the state.
Well,
Aligned in the same direction.
yes, so I think certainly this helps us have greater visibility and transparency with respect to the way that operations, occur within the Medicaid program. Right now, there's a great degree of delegation and fragmentation within the system, and the aim here is really to centralize, standardize policy across the programs, have better visibility into the operations, and again, have a more standard operation across the state.
Could I note on this one, though, John, and I'll speak from our office, they can speak a little more. The Trump administration hasn't given us anything concrete from CMS, and they're saying they're not going to comment. We couldn't get anything from them. We're not hearing what their fixes are. And then mysteriously, I found out last week on Tuesday, just coincidentally, I suppose, before I was going in front of that the committee in Congress received something from CMS, a report that we never saw. So let's level set here. The Trump administration's going to Trump. They're going to do what they do. What we're going to do is, this is long overdue, a modernization of these services. We recognize, like every other state recognizes, Medicare error rates are much higher than almost every other state. And the idea that this is something unique are folks that spoke out of turn. This is in every state. But what Minnesota does need to acknowledge, our system, both IT systems, are antiquated, and our delivery system over the years has become too complex. And as you saw this with, again, not criticizing the managed care organizations, but it's another level. And when something goes on there, if the state needs to be responsible for taxpayer dollars, we need to have it centralized where we can take that accountability. So, pardon me?
A lot of Minnesotans have lost trust in DHS because of the ongoing fraud issues. So what is your pitch to them that they should trust DHS to manage the entire system here?
Well, I think what you're seeing is when Minnesotans get a chance to hear the whole story, what you're hearing us say is, this fraud that took place in that happens downstream in places. It's more difficult to get a handle on it. The system needs to be centralized. Counties are telling us what the problems are. What we're saying is we're taking more accountability for it. We're giving a better insight into it, and we're putting the experts that know what they need to do in charge of that. So look, I know it's about gaining back trust. That's why it's really important that when we're talking about this issue, you don't just to throw out speculations. Anonymous people said this. Well, who are they? Have they turned them in? Have they gone to the police? Have we done some of these things? Or, I don't know, it's $19 billion or it's $75 billion. Be specific about what's happening here. And that's what we've been spending our time doing. We're pretty specifically in where things are at. We're able to triage in the moment, but this is a much broader view. And I have to say, I think there's going to be good buy-in on this because Republican legislators who understand this issue have been talking about the need to do many of these changes for a lot of years. So I think it's going to be about explaining exactly what's happening here, explaining exactly what the fixes are to do something about it. Because again, okay, centralized IG, how does that fit into stopping fraud? Because that argument is to bring everything to a central point to be able to have the centralized IG look at that, which I don't think is such a bad idea, but it's not the fix in and of itself. So I think it's continuing to establish this. I think Minnesotans have to recognize you're hearing about fraud in Minnesota because we are prosecuting people. You're going to hear about it in other states. You're going to continue to see it. But the fix is you don't want to hear about fraud not because somebody's not prosecuting somebody. You don't want to hear about fraud because you know the safeguards and the systems are in place. And I don't see there's not another model. No other state has gone to a more decentralized model. Every other state has moved towards a more centralized model of accountability, and I think that's what makes most sense.
Last one.
Yes.
So what do you need from, you putting out an RFP on the reorg, it sounds like, what do you absolutely need from the legislature this session to make this happen?
Well, and I think we can talk to the folks here, and again, we're certainly going to we'll hold the counties harmless on the cost. This is one of the things, we know that property tax increases, trying to manage this system. The legislature's worked on this. To follow up on that question that got answered earlier, the answer is how much will that computer system cost? We don't know right now. You're going to see in my supplemental budget that'll come out here before the end of the month that we will take an aggressive tact at that. I think the one good thing is this legislature, bipartisanly, has figured out how to do a better way on these IT legacy systems. We learned from MNLARS. So I think the one thing is there's a need to scope this thing very seriously on the front end before you put the investments into it, because these legacy computer systems are hundreds of $1 million investments. And with AI and some of the things happening, we're going to have to know. So what we need from them is some of the structural changes that change where the authority is, where we do the upfront management. We're going to need some of their buy-in. And quite honestly, this is out there today early enough for us to put together a joint package of what we need. Every year I put one of these forward, and I put one last time. I think since I put this forward last year, I don't think I'm going to find the resistance around some of the AI I asked for to look into this. And I would think this might be one that I think you should see a pretty good bipartisan buy-in and to flush out this system. And I'm open, as I've said it, I'm open to any ideas folks have, but I'm not open to cutting services off to Minnesotans. I'm not open to that we're just not going to do this. We're just going to kill these programs and not do it. And again, these are folks that need to raise their voices against the administration arbitrarily cutting these dollars where they can't prove and provide any details on this, that Minnesota's doing anything different than any other state. And in fact, with their own data, we're actually doing it better. So I'll make the case on this is we're aggressively attacking fraud, and it keeps us in the news, which I'm perfectly fine with, because in the 10 months that I've got left, it's my intention that we leave Minnesota with the strongest program integrity, and that we have a good step forward into a modernization effort that should have happened a long time ago. And I think the only way you can get some of these big things done is you do them going out the door. And I'm willing to take the whatever political heat there is for making these massive changes that need to be done. But in the long run, everybody will be served better by them. So we'll be back. We'll keep you posted on this. I think over the next week or so, you should expect a supplemental budget that I'm going to preview on this, with a war of choice in the Middle East, with gas prices spiking, with inflationary pressures going up, with all of the uncertainties. I said it in early January, February of 2020 before the pandemic hit, and I'll say it again now, a conservative, prudent approach to Minnesota put us in a position to have solid finances. I think the story that needs to be told is fraud is a piece of what happens in a budget, but the broader economic framework, the ability to be one of the 4 states with the lowest corruption rates, with the lowest error rates, with some of the best outcomes, to be AAA bond rated. Minnesota's finances are in a solid place. We closed the back doors on this fraud and we modernize while we have a chance. It puts Minnesota in a good position, but now is not the time for massive changes in the budget, for massive expenditures, for anything like that. So what I would say is you're going to see us focus first and foremost on modernization, program integrity, and protecting the services that improve Minnesotans' life. And this proposal captures both of those things. So thank you, and I want to thank the team that's here. Appreciate it. So thanks, everybody.